So recently in clinic we've had a lot of people with elbow pain, and elbow pain can be quite difficult to treat, and one of the reasons for that honestly is that people find it difficult to rest their elbows because they're always needing to flex their elbow, for instance to eat or to write or to use the computer. So the most common forms of elbow pain, we have two. On the inside of the elbow we have what's called golfer's elbow, and on the right outside of the elbow we have tennis elbow. Now the main difference between the two is that with tennis elbow, generally speaking, we'll get pain coming along the back of the arm, and golfer's elbow is generally at the front of the arm. Now the two things to know about this, the way that we would test tennis elbow is actually quite an easy test. We just push down on one of the fingers, and if that reproduces the pain up into here, you can be fairly certain that's a positive diagnosis for a lateral epicondylitis. Generally speaking, a lateral epicondylitis, a tennis elbow, is inflammation of the collection of muscles and the common tendon up into the lateral epicondyle. So it's a form of tendinitis, an inflamed tendon. Now the reason why it's difficult to treat is because when the tendon becomes inflamed, the collagen, the elastic fibres that form the main part of the tendon, get a little bit disrupted, and particularly if you get a little bit of scar tissue in that area, then the tendon itself can be quite susceptible to re-injury. So the main problem with a tennis elbow is actually the problem of re-injury. It heals a little bit and then gets re-injured. So how do we treat it? Well, treating the tennis elbow often requires understanding the author of the problem. Now you might say to me, well, the author of the problem is I have pain here, and of course you're right, but there's a little bit more to be said about it. And the more to be said about it is that we have to understand that the tennis elbow is an overcompensation. So it's a compensation to try to account for an instability elsewhere. And the most common problem that we find in clinic that causes lateral epicondylitis, a tennis elbow, believe it or not, is instability in the shoulder. And so what that means is when there's an instability or weakness in the shoulder, what patients tend to do, what we tend to do, is flex the wrist, rather extend the wrist, forgive me, in order to actually recruit the elbow to generate strength in the arm. And so what you might find as a test at home is if you pop the arm up here and pop the wrist down, maybe the shoulder is weak. If the shoulder is weak, then you're at risk of overusing the elbow because you tend to cock the wrist a little bit to generate the strength. So in clinic, if we find someone has a tennis elbow, we understand that there's an inflammatory process going on in the tendon of the elbow. But the thing that we really want to establish is actually, why did that happen?